Hello, how are you? Peris Mbuthia here, your host for Scarred and Skin. We talked about this. We said that we're creating a community of scarred and skin. And we started a podcast that I had said on the previous video. If you didn't watch it, go back there and watch it. That we are creating a community, me and Dr. Winnie Maina, where we're going to be talking to you about issues that we are all suffering. Why do we call this book Scarred and Skin? Because we have a lot of scars. We've discussed about that previously. Emotional scars, physical scars. Those who have never gone anywhere without makeup because of the scars they have on their skin, the insecurity they have about their skin. And today, me, Peris Mbuthia, decided I was going to do this podcast without makeup. Why? I cannot write a book called Scarred and Skin and then I've never maybe come to you bare face so you can see how do I look. Today, whoever saw me this morning, they're like, Peris, why do you look so tired? Apparently because I'm not having my mascara, my eyes are sort of looking tired. I look like I'm sick. I don't know. You will tell me. Please write there on the comment. Am I looking sick today? Dr. Winnie Maina, welcome to the podcast.
Thank you so much. And you look amazing. Your skin is, look, I love it. If this is 50, I want to be 50.
Thank
honestly.
you. Today I said, let's just be ourselves. Yeah?
And I'm among those people. I have not seen you without makeup.
It's serious.
Totally excited. You look amazing.
Thank you.
Yeah.
Unanipaka mafuta kidogo but ni sawa. But I've owned this, yeah?
Yeah.
Well, the reason we're having this conversation, Dr. Winnie Maina, is because of this, yeah?
Yeah, sure.
Some of us believe you can never be seen by people outside there without makeup because you've bought the narrative that you are only beautiful when you have makeup. And we are not saying wearing makeup is bad, but what we're trying to say is this: wear it because you want to wear it. Wear it because it's making you feel good, but not because you're doing it for other people.
Yeah.
That is the whole point of this book. True?
True. For yourself.
Exactly. And we want to educate people that. Because it's important I say that. I've been challenged by one of my friends who bought the book and asked me, Peris, you do skincare, you do makeup, so why are you writing a book that you're telling us we need to embrace ourselves and be? I said, yeah, because even if you're doing skincare, you're doing it because you want your skin to be healthy.
Yeah.
Not because you want to be someone else. That's the difference.
And I relate because I get the same question when we're having the skin health conversation because I run an aesthetic facility. So someone felt like it's conflicting. Why are you talking about people owning the journey, accepting whom they are, and you run an aesthetic facility? But here we are just to demystify some of these things because we want people to own their journey. If I need some improvement, yes, for yourself. But it's not because it's demanded of you by the society, the community, or people around you.
You got it.
Yeah.
And the reason we are here today is because, Winnie, I want you to let us know what is the difference between adult acne and sort of, for example,
Yeah.
I'm 51, yeah? Today I woke up with this pimple right here. I'm like, no, what is this? And the reason I came without makeup today, because I wanted when I speak, people see what I mean. And I'm breaking out also here. Mm-hmm. You know, you keep on waking up 1 minute, you have lashes here. The next, your skin is clear. And I've never, like I only suffered acne maybe after, for those who've read my first book, after my second baby, okay. Which I was on my 30. Really, as an adolescent, I didn't even get the acne. But after my first baby, I was okay. Second baby is when I had the acne. And now it's like coming back slowly. Not acne, but breakout here, there. Mm-hmm. So today I want us to discuss about that. Mm-hmm. Adult acne. Why do we get acne? Imagine, I've suffered as a youth. And then now, on your 50s, atunamuka tu kona acne.
Pimples.
What is that?
And you actually speak to most people because almost most of the clients I see with adult acne believe they shouldn't have it. It has been classified for a condition for teenagers. Mm-hmm. Young transition from childhood to teen and adulthood.
Right.
But about 15% of people, especially women, will suffer adult acne. Classically, in terms of science, has not different as much. Even some treatments we use for the young teen will still use them in adult. So the teen acne will start maybe even 12. We're seeing even 12 or 11 up to about the age of 24. But there's a certain percentage that transitions to adulthood with acne. You could transition because of genetics. You have genetic predisposition. You could transition if you have a medical issue. You've had people mention of something like polycystic ovarian syndrome, PCOS. And for your case specifically, we are getting into menopause.
The big M.
What happens here, especially in post or during menopause, there is a little change in terms of your estrogen hormone is dropping.
Yeah.
Remember, both men and women have testosterone or the androgen hormones.
Yes.
When I mention androgen hormones in women, they go, oh, that's for men. We actually have this hormone. So what is happening is during around the menopause, the estrogen is coming down.
Okay.
And estrogen is one of what we call the beautiful hormone, hydration of the skin, ceramides and all that. So this is a time, other than the breakout, because of the androgen now being dominant, the skin is starting to dry out. Wrinkles are appearing a little more, and dryness and all that. Even you didn't have something like eczema, you start seeing your skin is becoming drier. But classically, the hormones changes, especially towards menopause, is what will give you those simple breakouts. The premenstrual will be a little different. Most of the adult acne will see it along the chin, or even the neck.
Getting a little rashes.
There's one here and one. Yeah, but we can manage it.
Now, why do we also get the hair? Because that's the age also. You start seeing women are starting kupata devu. They're starting to get hair. No, I'm serious. I'm in that age. And I'm really embracing it. And I'm like, if it comes, I'll just take it with grace, because I am not the first one to experience this, and I won't be the last one. Why are women going through menopause also having hair?
Same reason. Androgen hormones, male hormones. Men have the beard, the chin hair, right? So this is a hormone that characteristic starts to give you the quote unquote, the masculine features. I'm just trying to simplify it so that you can relate. Yeah. So if you look at a gentleman, they have a chin hair, predominantly because of their male hormone. Remember we said our female, to say estrogen is coming down.
Yes.
So then the effects of androgen starts to be felt.
Yes.
Not because your androgens are taking a rise, but because it had been subdued by the predominant hormone in women, which is estrogen. And other than even the chin hair, the acne, quite a number of women will start thinning
the hair. Yes.
On the top, you're losing hair, or you're having some, such issues.
Yeah. So what are we supposed to do, Dr. Winnie? Is there something we can do to make sure that we keep this acne at bay, this breakout at bay, this hair? What are we supposed to do?
Fine. I'm a very big fan of wellness checkup in women. Even if these are natural processes that we anticipate, or when you come to me, you have a few breakouts. I have at the background, I have knowledge that this is what is happening. Or you have seen it even with your sister. Probably you were 2 years apart in terms of age, you're losing hair and all that. But before we narrow down and say this is a natural process, remember this age is also primed for other medical conditions.
True.
So if you're not seeing your physician for the normal general wellness, you could just maybe you've listened to Dr. Winnie and start to feel it's a natural process. Wow. Are there some other things that
underlying
issues that can give us chin hair, excess, acne, sudden breakout, hair loss? There's one specific case that had been referred to me. This lady was 46. All of a sudden, we are having very breakouts. Acne, from examination, I'm seeing there's a lot of chin hair, and then she's losing hair. It was chaotic, and this is not whom she had been, right? So, of course, some investigations come in from the medical perspective, and we take it, there's something else. Sorry to speak, we ended up diagnosing her with ovarian cancer. Oh, geez. Because we had to bring in the gynecologist. Yeah. There's something not right. Yeah. There's something not right. And you see, so let's not miss the wellness checkup with our physician narrow down just basically to skin. And this is acne, so
I like that
Amazing.
aspect because, see, assumption, right? A lot of people assume just because I'm now 45, I'm 50, I'm whatever, is definitely menopause. You go there straight up, it's definite. And you now say, oh, I'm just going to start taking care of myself. But that's not normally the case. So you have to always go for your yearly checkup, 6 months checkup, whatever. By the way, how many checkups should one do? I know personally I do every 6 months. But what is the ideal checkup?
You've done well. Annually is just enough, right?
Okay.
Remember, your physician will be asking a couple of questions. Genetic history. Are there familial conditions that are experienced in your family at a certain particular age? Is there anyone who's suffering this? Remember, as a country, we are not able to do the genetic typing early.
True.
So we can only do the preventive medicine. And what you're doing every 6 months, every year, that is a preventive medicine, so that we can catch anything earlier than.
I only do that because my doctor had said when I turned 50, because I've had cancer in both sides of the family. I've lost a grandmother due to cancer, a grandfather due to cancer, but different both sides of mom and dad. So my doctor then recommended it's important for you to do your checks every 6 months. So it's how about skin health? Now we are talking about skin health because we are very good at doing general
wellness checkup.
Skin health. How many times should we do checkup?
Badly it's in there when you're doing your wellness. You're going to see your family physician, your wellness physician, pass through a dermatologist clinic and have the dermatologist just, we assess from head to toe. We'll look at your hair, we'll look at your nails, we'll look at the skin, and basically listen. Your skin could be shouting something. It's purely a mirror of what is happening. I give the example of most of the time in accident and emergency. When you arrive, you'll see us pressing your fingernails to check. You never ask what the doctor is checking. He's checking about the blood, the perfusion. They'll check your eyes. They'll check your skin. Sometimes they'll pull your skin, hydration, and all that. So skin can be a very good mirror.
I like to say skin speak.
It speaks.
Always remember skin speak. And a lot of people ignore. That's why I had to ask you that. Because you'll find as people start aging, they will say, I don't need to go to a dermatologist for what? My skin is just perfect. I've embraced my wrinkles. You forget it's not just about wrinkles here.
Yeah, it's not about
right.
Wrinkles.
Skin is not about.
It's not about aesthetics. I remember when we were writing the book and talking about it.
Yeah.
The cosmetic function of the skin is among the last. It's very functional. It's an organ. So we'll be looking at all other things before we arrive at you have wrinkles. There is a spot that you don't like. That is the last thing I'll ask you. What else do you feel that, But looking at it, is it in good functional and healthy state?
Yeah.
Is it showing us something more that we need to investigate? The case that we've talked about, it was acne. And then ended up being something else.
Yeah. So people need to really go for their checkup. Checkup, if not every 6 months.
Yearly is reasonable.
Yeah.
If your doctor picks something, even during the routine, I know, like when you're doing pap smear, you will do it annually, and then the doctor sees results, they are fine, and they tell, let me see you in 2 years, Winnie. Let me see you in 5 years. Or they tell you, I'll need to see you annually or yearly because they have picked something and that they really need. I need to keep an eye on this.
So, Dr. Winnie Maina, that was really good and kind of you to break down the difference between adult acne, that comes after you are grown, like you're like, this should not be happening. It should be my daughter going through this, not me. It should be my son, not me. But now, what advice would you give us apart from just doing yearly checkup? What can we do that we can manage at home this condition?
Okay.
Yeah.
I will go back to skin communicating what is going on. Fine, there are no other issues. Is there something you can do a little more, especially towards the adult acne? Remember the metabolism factor, right? The high glycemic food that spike sugars, and the sugar ends up affecting the hormonal bead. So you have to move slowly towards the healthy side. I know people
Dr.
make fun
Winnie.
and tell us, when you start taking your things with less of sugar, you're exercising, old age is coming. It literally, old age is coming in. Sure enough.
Literally.
Yeah, your metabolism is changing. And remember, if you're now dealing with acne, you're gonna cut down some of these foods that spike your sugars, because it will accelerate. The wellness of exercising and all that is also taking care of your hormonal aspect. You're reducing the cortisol and getting into more endorphins when you're excited, and the exercise and all that. And then if we now have to manage them from the medical perspective, there's something we prescribe. All right?
Yeah.
And then after that, remember, this is not for everyone. And we normally say severity of any skin conditions does not correlate to how people feel like. They have someone who is confident walking with whatever typical acne. They are not bothered.
That is so true. Confidence at
There's
the highest
someone,
level.
2 pimples will give them a sleepless night.
True.
And we don't judge them.
True.
We've got even clients who have now this more phobic acne. Because of that single pimple, they don't want to show up at work. So whatever skin condition someone is going through does not relate to how they feel.
Very true.
It does not relate to the form of treatment.
True.
When I see patients with adult acne, the first question I ask them, in a scale of 1 to 10, how much does it bother you? It may look just like a simple question, but it opens my thought process. What is this patient looking for? Am I gonna be a little more aggressive in terms of treatment because of how they feel? How soon do I want to see results? Because that equates to their quality of life.
Very true.
So the treatments, even the treatments we have in the clinic, your prescription will not be the same
As
to
someone else is true.
Because when I ask, in a scale of 1 to 10, tell me how much it bothers you. That is where my treatment is. Because I want to get you into the confidence side sooner, the better. And then we tend to be also a little more aggressive in managing, adult acne, because at this particular point, our patient, our client understands what's happening. If they're younger, like in teen, we're giving them time to transition, yes, while still getting hold of their self-esteem and making sure they are not breaking out as more. So that is the outlook. There's no one shoe size fits all when you're managing adult acne.
Yeah.
It all relates to how they feel, how it interferes with the quality of life, and they should be able to
Does
live
it
a normal
pass?
life.
Does it pass?
It does.
Yeah?
It does. Once we comprehensively manage it, once in a while, if the triggers come in, you'll get a pimple or two. Like even time like menstrual flow, you're stressed, you have traveled, you have overindulged. And the beauty of managing the adult acne and having this conversation with the patient is they understand every critical detail of the condition.
True.
And I told you earlier, the first thing of managing any skin condition is the patient owning the journey.
That's so true.
I'm not pushing prescription, I'm not pushing product if you cannot understand what is causing it, what are the triggers, how am I going to help doc to help me, because we are in it
It's a
together.
partnership.
Yeah.
I like that. So you treat from the grace side, you give somebody grace and they're able to
Yeah.
connect and they're able to heal. Because
Yeah,
sometimes skin will just heal itself.
It will.
You just need somebody to tell you,
It
you
will.
are okay, I got you, and you find yourself. Now, since this book is about scarred and skin, and our podcast is about scarred and skin,
Yes.
speech aloud scarred and skin, Dr. Winnie, you must give us one of your scars where skin is concerned.
Wow.
I'll share mine too, if that will give you,
Yeah.
I know mine is not a secret because I've spoken about it in my first book, The Audacious Dreamer, right? Like after my second baby, I had this bad acne, and because I'm light skinned, and I had this big cyst that, from here, and it's like they multiplied every day. So today you have 3, tomorrow you have 6, within a week,
There are more, they're all over.
the whole face is covered with them. And so when people would speak to me, they would speak to me like you can't go see a doctor. And I was in Canada then, and I was a youth teacher. And it slapped me so bad that I started feeling like I can't even teach the class. I started hiding under makeup. And that's when I actually started using heavy makeup, because then I would try and cover up. And the more I tried to cover up, the worse it got, because the skin wasn't pretty. And you can imagine, this is so sad. I'm a dick trying to hide themselves. And, the reason I wrote this book is because of that. Because apparently we professionals are supposed to be looking perfect. And so when you're going to go treat a skin, people first thing they are looking is your skin.
Yeah.
Do you even qualify to speak to me about this? Have you looked yourself in the mirror and see how you look? How dare you come and tell me how to look when you look like that? And then people forget it's about the skill that we've learned how to treat. It's not about how we look.
You can't change.
Change. Thank you.
Yeah.
Even doctors get sick. Nurses get sick. Therapists get sick. We get sick too. We cannot protect that. Do you have a story that you can share, and how did you overcome that? Because I know mine, how I overcome it is through a lot of grace from God. Because even when I opened Timeless Medical Spa, honestly, in the midst of opening that clinic, because I had come from Canada to Kenya, I was stressed. I left my family behind. So let me tell you, Maina, literally the way Kenyans say it, let me tell you, Dr. Maina, my skin wasn't cooperating. It was breaking out like crazy. And yet I'm here introducing a new thing in Kenya, medical aesthetics. That was 10 years ago. A lot of people did not know about medical aesthetics. And all of a sudden I did not look like it. I was this light-skinned girl because I'd come from winter. My skin was really pale, but was breaking out. And so I was praying God every day, God, please, when they see me, let them see you, not me. Let them hear what I'm telling them, not looking at how I look. And do you know, Dr. Maina, because of being authentic, because of me telling people, do not look at me, listen to what I'm telling you, I'm also trying to heal me as I'm helping you heal. We're going to heal together. Seriously, people loved it. And by people loving it, people loving me loving on them, I swear, as I was helping them to heal, I also healed. My acne just disappeared, and somehow my business thrived. And it's 10 years since that journey, right? So I learned something from that, that also expertise that we have is what matters. We shouldn't be afraid of people judging how we look, because if we appear authentically, people also connect to that. They're like, oh, she's authentic. He is authentic. They're walking there. They're talking there. You said they're talking. You know what? You're walking your talk, right?
Walk the talk.
Walk the talk. You're walking the talk, right? So you're not just treating because you're perfect. You're treating because of the skill God has given you. And you went to school and learned about this. But that doesn't mean that you never wake up with a pimple. It doesn't mean your skin will never have hyperpigmentation. Like now I'm getting older, and all the sun damage that I got when I was young is now coming to the surface. And I'm starting to say, you know what? Wear your skin and wear it well proudly, because you own your age. You're 51, you're not 21. So if people expect you to be having a smooth skin, no wrinkles, no discoloration, that's a lie. Do you get what I'm saying?
I see you.
So that has been my journey, and that's why I decided, Dr. Winnie Maina is the best person to do this with me. Very because nice. First of all, we are not of the same age, so we need to speak based on our season of life. So what I'm going through is not what you're going through. It's not what I'm going through.
Yes.
So what is yours? That was mine, and somehow through the grace of God, I managed to overcome it.
You caught me off guard, because I have not spoken about my fast anywhere in any platform. But this relates to my practice and empath and connecting with the patient. Maybe most people don't know how I connect so deeply with my patients. But most of these things is because of their personal experience. And if I relate to skin and scars, I can go back to high school, right? Growing up in the village, walking to school barefoot. And this was the...
You, Dr. Maina, walking barefoot.
A few kilometers, it's dusty and all that.
Yeah.
So it came time I needed to go to high school. One, we had shaved hair all my life in primary school.
Okay.
So I'm starting to grow hair now. It's really hard and curly. That passed. But one of the highlights I remember is we were being admitted. I have my hair. My sisters still make fun of me because what they used to call nywele ndengu.
Yes.
And my mom, when we are on the queue, could now whisper, unaona nywele ya wasichana wengine ni mrefu na hii yako ni ngumu.
Oh my God.
Lazima utakumbuka.
That's a scar by itself.
It's a scar.
Yeah.
But honestly, it didn't seem like it until now. Then from that, remember I was telling you, we were walking to school in the village. There's dust. Now you're now starting to mingle with people who have come from the city, who had been into boarding school. Then we have been given uniform to dress in. You have now you have shoes.
Yeah.
And there's this condition that gets onto your legs when you have been in dust and you're not moisturizing well. It's
cracking.
Like cracking.
Your skin is cracking.
My skin is cracked on the feet. So I remember one girl laughing behind me. Akona miguu inakaa kitabu ya hesabu,
Oh, ima. Na Kikuyu we call it miatoka.
Yes, not even miatoka. I know that I had been walking to school all my life, and then this beat you crack. In dermatology, you call it something like xerosis because of the dry skin.
Yeah.
But you now that what followed is that all my socks, I could pull them to this level.
Just to hide the skin.
Whether it's hot, whether it's cold. Of course, I schooled in a very cold season, so there was also the aspect of leg warmers. So that is what I used to hide in there.
I see.
But that word never left my head.
Scars.
So I've struggled for a very, very long time to wear open shoes.
Serious?
Because I still remember that girl.
She really got into your head.
She really got into my head. Remember, you can't engage with them. You've come from the village and all that. They look like they have it together. They know how they are eloquent. They can speak. You can't speak. You're learning to start speaking in English. So you curl back and try to protect.
Yeah.
So I survived with my leg warmers. I survived with my cracked heels.
Yeah.
And now when I'm doing the prescriptions in dermatology, or when I'm seeing even young adults or very young children with eczema, they are pulling the sweater, like I relate.
You can relate.
I relate because I know, especially the teen, this is a time most people are looking for affirmation, and the peer status is very important.
Very true. It's the currency according to the youth,
Yeah,
how
the
they
peer
look is their
status,
currency. Yeah.
the peer appraisal is a very critical thing in them. So beyond the skin, there could be scars. And other than treating superficially for the condition, we try the best as dermatologists to go deeper to what else could this person be struggling with.
Skin deep. Do you find that your scars have made you become a good doctor?
Definitely. Because I will go beyond what I can see.
Very
to
true.
how you feel.
Very true.
To how it's affecting your life, to how your family is. I know it's a very thin line between being an empathetic and a sympathetic person. I've struggled with that just to draw the line.
Yes.
But it has made me a better practitioner.
Yeah.
Because I'll be able to own how my patients feel.
Yeah.
Can they pay? Do they have the spending power? Do they have support? People will come in and tell them, next time you're coming, come in with your sister. Because I may not be able to support them virtually, but there's someone that I can link them up. This is what is happening. And
very true. Do you see me? I'm getting emotional as we are speaking about this, just thinking of the people we're going to, that story. There's a girl right now, who just joined high school from the village that will connect with this story and say, wow, Dr. Winnie, you just give me permission to be seen. I'll remove my socks.
Yeah, and we'll tell them how to handle it. They'll just need to moisturize. I didn't know if the Vaseline my mother had given me from the village would do the job. In 4 years, the mathematics lines had cleared.
They disappeared.
They had disappeared, though the scar remained. So I'm very, I was always conscious of.
Okay, as we finish, what would you tell that girl? You see, that girl in high school, this is Dr. Winnie now. She's a doctor. She managed to somehow survive her scars
Yeah.
Of course, we are looking at you, beautiful. Look, you're exposing your beautiful legs.
No, my legs
So
can
you
be
healed
I healed, yes.
clearly,
Yeah.
but there's still that voice at the back of your mind that reminds you that girl. What would you tell that girl? Because that girl, there are many in high school right now. As we speak,
Yeah.
there's a girl today that was bullied because of her legs. Yes. What would you tell that girl?
There's purpose in all of us, and mind is a muscle. I happen to have gotten a cheerleader. My dad was always telling me I'm the best. So even when that happened, I ignored it a little bit and now focused on what brought me to school
Yes.
to become better and all that. So what I can tell them is the voices of that we can't, or you this will always be there. Even right now as we do this as adults, the voices of naysayers are still there, but ignore that. The mind is a muscle. If you feed it through that negativity, it grows.
True.
And it will affect who they are in
Very
school.
true. Very true.
Focus. You were in that mix of people who have come from elite families and all that because you were a girl who was picked from the village to be in that school to do better. They are brilliant, they are bright, so they just need to focus with what got them in there.
Okay.
And they'll come to this other side of the world and fix
And they'll be all
whatever,
right.
and they'll be fine.
What about to the girl who caused the scar? You've just spoken to the girl who has scars because
Yeah.
they were caused by a bully somewhere, because
Yeah.
that was a bully.
Yeah.
What would you say to that girl who caused the scar, or that boy that is causing the scar to others? What would you tell
I'll
them?
tell them, let's cut them some slack. Most of them will say this and giggle because they have no knowledge of the impact or the scar that they are giving to this other person. Let's be sensitive. Whatever we say, however we say it, to anyone, irrespective being our peers, our parents, whoever we interact with, it elicits some form of emotion. So whatever you open your mouth to say, put yourself in that shoe. If someone else said it to me, how did it feel? There you go, the answer.
I think
And
we're
you
going to
become
edit
more
here.
a gentle person.
Yes.
You become a person of holding others, and we make our world a better place.
That's so true.
Yeah.
And sometimes, just to edit here, people project what they are going through to others.
Yeah.
Sometimes I came to realize bullies are themselves have been bullied,
Yeah.
and now they become big bullies. Do you get it?
Yeah.
So sometimes they are projecting their own insecurity. So for the girl who looked at your leg and projected her insecurity, maybe she was suffering something
Which
else.
we didn't know,
Hers
yeah.
was not. You will never know,
You
right?
never know.
So that was very good advice that you've given us, and that's why we are doing this, Dr. Winnie. We want to heal out loud. We that God has helped us to get over our scars, and there are some that we are still trying to get over. We're not
Absolutely.
completely healed. Trust me.
Absolutely.
Dr. Riapa just said that sometimes she remember that. Me too. Sometimes when I wake up with a pimple, I am taken aback to, oh my God, are they about to start multiplying? And now,
Yeah.
you get what I mean?
I get
So it's a continuous journey.
It's a
It
journey.
never end.
Yeah.
Journey of self-love, self-care never end.
Yeah.
Doesn't matter our age.
It doesn't.
And that's why we are calling this scarred and healed. From scars to healing. I think this is where I'm going to end this podcast today, Dr. Winnie. And I
you.
cannot wait for the next one. And for those who have not watched the first two that I've done with Dr. Winnie, please go back so that you can watch it, so you can understand where we are, right?
Yeah, it's
so they need to
exciting.
go back. And now, before we finish, Dr. Winnie, a girl has connected with you. She's going through something. Maybe her skin is breaking out. I don't know, whatever it could be. But they feel, I need to meet Dr. Winnie as a dermatologist now. I want her to be my dermatologist. Where can we find you?
They'll find us at the Jalada Aesthetic Clinic. We are at the Family Health Plaza ground floor along Maimahi Road off Timol Junction. You can also reach us on phone 0719 458 685 or find us on across all social media platforms as Jalada Aesthetic Clinic. I'll be able to see them.
Awesome.
Yeah.
And from Peris Mbuthia and Dr. Winnie, we say bye until the
Bye-bye.
next episode.